We have House Intel Committee member Congressman Mike Turner joining us now from Ohio on what the next step is for the GOP right there. I don't want to digress too much, Congressman, but on the intelligence issue and whether you think the chairman should recuse himself from this Russian investigation. Some Democratic colleagues are going so far as to say he should leave, period. Where do you stand on this?
Well, absolutely, I support the chairman, Devin Nunes, and I think the reason why the Democrats are going crazy is he got really close to what may be the heart of this whole issue. As you know, we have the FBI Director Comey saying that there were leaks. These leaks are criminal of information that was intelligence community communications that were likely intercepted on the Trump transition team, and those are criminal actions. But more so, the chairman has come forward and said this appears to be surveillance that was occurring of the Trump transition team that was shared with perhaps officials of the Obama administration. We need to know who those people are. We need to know if it was improper. And as it gets closer to that, you hear more and more Democrats saying, wait, we need to stop this investigation. We need to stop Devin Nunes. I think we need to get to the bottom of this, just as, more importantly, we need to get to the bottom of Russian interference with our elections and how can we stop it in the future, and were there Trump campaign connections, and follow this investigation to where it leads.
All right, let's go back to health care, if you'll indulge me, and get a sense of how prominent an issue that will be for you. There's talk here that Republicans really want to get on board and unified on this, but that might be easier said than done. Don't the same issues still exist?
The issues do, but I think it was very welcome to hear the president say that we're going to look for a deal, and he was with senators, because that actually holds the key. I can tell you this, that there's no bill that's going to come out of here that's negotiated with the Freedom Caucus here in the House that's ever going to pass the Senate. You need 51 votes over there. I was not going to vote for the bill because of the provisions that they had put in the bill. First off, there are people in my community who are going to be losing health care coverage, where the president said we're not going to be taking away health care coverage. And then the Freedom Caucus asked us to take out maternity benefits, pediatric care as requirements. Those are never going to fly in the Senate. So what I think that the president should do, and I hope that his message last night was part of that, is let's get a bill that 51 senators can get behind, because I have a feeling that bill will probably sail through the House.
Then it's on to taxes, or do you try to do this concurrent with taxes? Because if the message I'm getting, and it might change from Sean Spicer to the White House, don't rush this, then does that also mean don't rush the tax cut thing?
Well, we can only vote on one thing at a time, but it doesn't mean that we have to work on one thing at a time. I think it's absolutely essential that we work on all these issues and continue to move them forward, get a consensus, find out where the Senate is. There's no reason why the House and the Senate can't be in negotiations on a bill that both houses can agree on, that we can put on the president's desk.
Congressman, do you think tax cuts should be paid for?
I think certainly to a great extent, but you do have to recognize that there's a dynamic aspect of tax cuts. There are tax cuts that grow the economy and then in turn result in increased revenue to the coffers, and so that has to be taken into consideration as you go through this transition, that we're talking about growing the economy, more jobs, economic growth that certainly is going to be better for our country and for all of our communities.
So to some of the more conservative members, and even those who aren't quite so conservative, say they have to be revenue neutral. What are you saying?
Well, if you act that they have to be completely revenue neutral, you can't create revenue, right? I mean, if you say I'm going to cut a tax that doesn't even result in increased revenue, that's neutral also. I think we need to look at tax cuts that are targeted toward growing the economy, creating jobs, putting people back to work, moving America forward.
Your sense, too, about how actively the president should involve himself in both the health care rework and the tax cutting. What do you think?
I think he should be actively involved. I mean, obviously, the president made promises on the campaign trail, one of which was no cuts in Medicaid that are going to affect families. We're going to have a health care bill that doesn't result in health care benefits being taken away. Certainly that happens in the current bill in my community. I think the White House's hand in getting negotiations between the House and the Senate would be very helpful.
Is it your sense that Republicans feel the pressure to get the tax cut thing done even more than the health care thing done?
I think there's pressure with all of them. And the reason is because these need to be done for our economy. This needs to be done for health care, for our economy, for jobs, for moving the country forward. All of them are important, including rebuilding the military. That's on the president's agenda. I serve on the Armed Services Committee. We've got to push that one forward.
All right, Congressman, thank you very, very much. Good talking to you.